All right, we are going to finish up health comm and organizations in this video. So we'll go ahead and jump on in. So we've already talked a little bit about organizational culture, how it's communicated both formally and informally. And strong organizational cultures are going to facilitate solidarity, meaning they stand together. Meetings are created for everyday events that are happening within the organization, and they're shared to other organizational members. So, communication is huge for organizational culture. It helps improve healthcare outcomes, which can include improving communication competencies, changing specialization and training. So, this could be interprofessional education, and it can help change the culture. Like I said, communication is huge for culture. So, let's talk a little bit about structuration theory. It explains culture creation and recreation. An organizational culture rarely changes, but it can slowly shift, right? So rarely will you see an organization just downright change their communication or change their culture, but you can see slow gradual shifts. So structuration is the process by which a social system, like an organization, produces and reproduces itself. So how do social systems produce themselves and reproduce themselves? Well, that's what we're going to talk about. So, organizations exist because of and within communication. Without communication, organizations would have no chance. Communication must be continuously, or organizations must be continuously recreated and reproduced. So, something that you've done for the last 6 months might not be working anymore. You're not going to have the same thing that you're doing for 20 years. You might have same actions or reactions to things, but you've got to continuously be recreating and reproducing a culture. Reproduced and recreated culture, each time someone communicates or behaves in a way that the organization was originally created communicatively, right? So it is reproduced or recreated every time somebody behaves the way that it was originally created communicatively. When rules or policies, let's just say policies, not polices, are no longer enacted or reproduced, they stop mattering and they stop existing, right? So if there's a rule at your organization that it doesn't make sense, so everybody just quit doing it, that rule will stop existing. And that is recreating the community, the culture. Social systems are governed by informal rules and resources. Informal should not have been in air quotes, but rules and resources, because they're not things that you're going to find in a handbook. These are guides for how to act, think, decide, speak within that organization. So patterns of behavior that organizational members witness or they learn somewhere in the past. They form this recipe of what to do next in the here and now, right? This is what's worked. This is what we're going to do. We've had these jobs sometimes where things don't make sense. Well, why are we doing this? Because that's what we do, right? It's very informal. This is how we act, right? We follow this recipe for it. So following rules and norms set in this recipe can produce the organization. And then once those start getting dry or tired or unused, then it starts to reproduce the organization because we re-up that recipe. So values must be constantly represented or voiced to survive and shape the organization. So they can either be voiced non-verbally or verbally, but they've got to have a constant presence. Otherwise, they aren't going to shape any part of the organization. If values aren't communicated or assumptions are challenged or changed, the culture begins to be reproduced in a different way, and it changes things ever so slightly. However, the organization is constraining. So the organization is a system, and others exert social influence to stay consistent, ultimately preventing change. But if they agree with changes, either explicitly or implicitly, it can spread, right? So the culture is always constraining. So takeaways so far: organizations are social. Culture is co-created by members of the organization. Change is enabled or prevented by individuals across the organization, especially in segmented systems like healthcare, and change can be difficult. Okay, so organizational influences on health communication. We've talked about culture. Now let's talk about role stress, emotional labor, and burnout. Cultures here again a little bit. So values, attitudes, beliefs of the norm within the organization are socially constructed and reinforced. Formal rules, informal social pressure help shape, change, and keep it constant. It's co-created by individuals across the organization, and they interact with the organization responsibilities to facilitate or impede work and well-being. Organizational culture, formal structures, and the nature of work cause negative psychological and emotional outcomes. These are the role stressors, and that's where I want to go next. So, role stressors are reorganization and expansion in healthcare that has caused problems with command and authority. So, increased specialization means departmentalization and decentralization. So, everybody is kept separate. You are your department, you are not a member of this hospital. And that can be pretty disheartening. Changes in payment insurance options creates more administrative work. Administration has to go in and fill out all of these forms, and that can create role stressors. And provider shortages, acquisitions, and technology. If we don't have up-to-date technology or enough physicians, then we're going to be drowning. So, what are some stressors in healthcare? Well, staff shortages and work overload. One of my best friends is a nurse in our hometown or near our hometown, and part of her duties, and she works on the oncology floor. I mean, like literally being a nurse is hard enough. Being a nurse for people who are going through cancer, I can't even imagine. She works on this oncology floor, and everybody in her department was told they have to pick up an extra 12-hour shift every 2 weeks, which doesn't seem like a lot. But you can split it over 6 and 6, 4, 4, 4, however you want to do it, but you have to have an extra 12 hours per week. Abby works 3 12s a week, 12-hour days working with oncology patients. And now she has to have another one. So, and it's because of staff shortages, because her organization let go of some temp nurses who then signed contracts elsewhere because they were stupid. Time pressures and increased bureaucracy. We want patients in and out. Don't spend more than 10, 15 minutes with them. Multiple supervisors. They don't have the same information. They do things differently. So that creates issues. Conflict with admin and coworkers. We all have coworkers that we don't like, but that can cause stressors in healthcare. And feeling with and for patients, uncertainty on how best to treat them. That can cause stress because you want to help these people, but you just can't. So with stressors, we've got role conflict, role ambiguity, and provider burnout. And these affect provider performances and hinder elective communication. So let's talk about role ambiguity. These are uncertainty about duties and roles. So there is a lack of clarity. Documentation and administrative tasks are not clearly outlined, and they make providers question if patient care is their main concern. And it creates frustration and distracts from patient care. Because I'm not sure about what I'm supposed to be doing, I have all these questions about my patient care that go unanswered. Role conflict is being caught between 2 or more mutually exclusive expectations. So you have to do multiple things that are incompatible at the same time. So, examples: online patient information entry while tending to needs and relationship trust. So think about it. Anytime you've gone to the hospital, your doctor is typing on the computer, typing all your information while they're trying to build rapport with you. How are you supposed to pay attention to be able to type things into these charts while you're also building trust? Another one is answering phones or responding to electronic messages instead of administering direct care. So I'm supposed to be in with my patients, but instead I have to answer the phones. That's role conflict, different from role ambiguity. Stress and burnout. So burnout is a combination of emotional exhaustion, depersonalization, and reduced feeling about personal accomplishment. So with burnout, you are emotionally exhausted. You feel like you're just another cog in the machine. You don't have a sense of self-worth or understanding, and you don't feel like you've accomplished much personally, right? You just get burnout. It's the same thing that happens when you're seniors in college. For the past 4 years, you've been a face in the sea of students at WVU, and now you're starting to get burnout because you're almost done, right? That's burnout. Emotional labor is a job related need to show socially appropriate emotions while interacting with others. So, having to show empathy or concern for patients to comfort them, we have to suppress our anger and sadness for people who make our jobs harder or people who aren't doing their job correctly. So, we are suppressing what we're actually feeling and putting on a brave face for everybody around us. And this is emotional labor. With emotional exhaustion, we feel drained and used up. We don't have this motivation or compassion anymore. It prevents the identification and addressing of emotion. So I can't even tell you what I'm feeling because I'm just so exhausted. And attending to the conversation becomes more difficult. I just don't want to be in this conversation anymore. It can lead to imprecise care and more errors. Depersonalization, we treat others in an unfeeling or impersonal way. It comes from being exhausted and wiped out. I feel like I'm not important enough, that I'm just a cog in the machine, that I treat you the same way. It's very impersonal. It can cause burned out providers, to see others as annoying or adversarial, meaning your problems are just annoying me. I don't want to talk about them. It signals disinterest to patients and creates passive reaction, so divergence, separation, and it prevents the building of trust and ineffective team collaboration. So there's also a reduced feeling of personal accomplishment. So we feel like a failure. There's depression, low self-esteem. We quit our job, our profession overall. We don't want to be a nurse in the oncology department. We just want to be a nurse in pediatrics. So we quit that part of our job. Or it gets to the point where I just want to be a general nurse. I don't want to work at a hospital. I want to work at a clinic. Or we quit the nursing profession altogether. And we avoid certain on-the-job tasks. So with stress and burnout, there are some outcomes. Increased turnover or calling off. So we quit our jobs and we call off as much as possible. It can lead to heart disease, depression, damaged personal relationships, medical errors, which we don't want, and greater patient readmission and slower health improvement because they feel like they are the problem for your burnout. And the last slide is a repeat slide. So that is the end of health communication and organizations. Next, we're going to talk about health insurance. We will start with health insurance in the US, and then we'll move to health insurance around the world. All right. See you in the next video.